Thanks for joining us for our conversation around environment as a social determinant of health and what strategies we can employ both in the role of facility or sustainability leaders, as well as for those who work in community or population health across our nation in our hospitals and health systems. So here's the plan for our time together today. We're going to start in the same Zoom room, hearing from one of the leading experts in the field around climate, environment, and the role of health and healthcare in being part of the solution to the problems that we all are facing. Then we're going to break out into discussion rooms and talk separately with some frontline leaders from across the country who will share some of the key tactics that are working in their organizations. And it'll be a chance for you to be able to talk with them and each other about what some options might be for your own organization. So I'll fill you in on how to choose which Zoom room to go into a little bit later after we hear from our main speaker. We do want this time to be as interactive together as possible. So next slide, please. So we welcome your comments, your questions, and your suggestions. While your phone lines or your audio lines are muted, we really would like you to use the chat, both to ask questions of our speakers and to talk to each other and share with us and with each other what you're doing. So to kick us off, I'd like to turn the stage over to a great colleague and supporter of this event, Terry Scannell from Vizient. Terry's the Senior Director of Social Responsibility and Community Benefit there. And those of you who've ever worked with her or know her know that she is a leader who really works at fostering change for families and communities across the country through her focus on sustainability and partnerships to improve health, including, but not limited to, the area of environmental impact. So Terry, kick us off.
Thank you so much, Nancy. And I'm delighted to introduce Jeff Thompson. Dr. Jeff Thompson was the CEO of Gunderson Health System. He had that role for 14 years. And Jeff pioneered the path to achieving ambitious goals through an organizational values. In 2008, Jeff was Gunderson's CEO, and he set a goal for the organization to control rising energy costs and also improve the health of the communities it served. Gunderson focused on two main initiatives: reducing consumption by improving efficiency and also creating cleaner energy. And that was absolutely a leading program within the nation. And the interesting thing is that even back in 2008, Dr. Thompson set out not necessarily to make the greenest healthcare system, but it set out to make the air better for the patients to breathe, control the rising energy cost, as well as help the local economy. And under Jeff's leadership, Gunderson made more progress on all three of those initiatives than any other system in the country. During Dr. Thompson's tenure, Gunderson Health System developed an energy program that decreased greenhouse gases by 95% and also decreased hazardous waste and pharmaceutical waste by 98%. And also, it was the first U.S. healthcare system to achieve energy independence. On certain days, they generate more energy than they use. Gunderson and Jeff have been repeatedly recognized as nationally for their excellence in quality and cost effectiveness. Under Jeff's leadership, Gunderson earned HealthGrade's highest honors, America's 50 Best Award Hospitals through 2012 through 16. In 2015, Jeff was the Visionary Leadership Award winner by Practice Green Health. He is the only U.S. healthcare provider to speak at the Paris Climate Talks. Jeff also received the White House Champions of Change Award in 2013, and Jeff is currently the co-chair board of Healthcare Without Harm. Jeff is a pediatrician and an author. His book, Lead True, Live Your Values, Build Your People, Inspire Your Community, is an excellent read on how to achieve tremendous lasting change for future generations through one's values. He's an agent in change and a visionary leader. And over to you, Jeff. I'm so thrilled you're here.
Thanks, Terry. And with that, I'll take questions because that's pretty much the whole shooting match right there. Yeah, that was lovely. And I appreciate the compliments. I believe that this is all based in values, and it's what our responsibility is as healthcare organizations and as organizations that support the delivery of care. The American Hospital Association has said this is important. Let us gather people together. Thanks for doing that. I'm also working with the American Hospital Association on the National Academy of Medicine's Grand Challenge that they are a part of as well. So it's no one group, no one person is going to move the dial. And I think that's something to remember in this. You by yourself, me by yourself, we're not going to make a massive impact on climate change. But as a group, we can lead, and we can lead others. And I'll try and give you some examples. When the healthcare system stood up and said, not we want to become the richest, we want to become the biggest, we want to get have the fanciest billboards, but we said we want to take care of the health and well-being of the population. That's our job, the health and well-being of the population. We talked initially mostly about pollution. We didn't talk about climate. Now, if you talk to me privately, I would have given you tons of data on why climate was dangerous to the region and to the world broadly. But we talked about health of our local community, that what pollution does, what water, air, food, pollution to our food, all those things do to the health and well-being of our local community, and how we can take steps to affect that, whether you're a mid-level facilities person, the population health coordinator, whatever your role is, you can do those things. So it was about health. There's a big study that came out, it's easy to find, we'll put it in the links, a big Harvard study that came out that said pollution alone, leave alone the climate change, leave off the climate change effects, which are huge. Pollution alone kills 8 million people around the world. You say, well, of course, India and China, I happened to be in China when their Secretary of Health said that they were killing 1 million people a year from pollution. They had never done that before. That was several years ago. They're admitting to it. India's admitting to it, of course. But in the United States, 350,000 people die from the pollution that we participate in. And we're 20% of the economy almost. So we make a fair amount of the pollution, 10% of the greenhouse gases and a lot of the other pollutants. 1 in 5 people dying, 1 in 5 around the world die of pollution-related activity. And of course, one of the most important pieces for us to remember here is this is focused on the most vulnerable. It's like everything else. When an economic downturn happens, who gets beat up the most? Well, big investors lose large amounts of money, but it's ultimately disposable for them. It's the poorest, those with the least education, the least assets, and that's who's hurt most by the pollution as well. So what we did, and what many around the country have done, a rising number of organizations have said, this is our responsibility. This is part of our values. We're going to live all those nice words that are on the walls of the building and in your mission statement. We're going to say, this is what we're about. The purpose of our organization is to improve the health and well-being of patients and our communities. We've pivoted from just being a fix-me-up shop for broken legs and heart attacks to saying we have a responsibility to the health and well-being of the broader community. And we can make an impact across the community, but especially on those who are most vulnerable, who the children from the neighborhoods with still poor ventilation and paint on the walls that has lead and have taken the biggest hit from the pollution that's been caused. The children with the asthma, the adults who have breathed in particulate matter. So we took this on as responsibility, and you saying, well, that's really nice, you did that. And of course, you were the CEO and the board chair at the time, so it was easy for you. Actually, wasn't so easy. 2006, 7, 8, we certainly didn't mention climate change at our board meeting. We would have gotten nowhere. What I did mention, though, is we measured how much pollution our energy was putting in the atmosphere. So I went to the board and said, we're putting in 450,000 pounds of particulate matter into our regional air that our asthmatic children breathe, that our adults with COPD and cardiac problems breathe. Is that okay? And they said, well, of course not, it's not okay. We framed it around health, the health of the population. But they said, you can't do anything about it because it's too expensive. Well, this was a piece of conventional wisdom. Remember, if you're going to innovate, one of the key pieces is a disciplined disregard for conventional wisdom. You don't ignore all conventional wisdom. What your grandma told you, I'm sure, is exactly true. But most everything else, you should just look at it and say, does that really make sense? Or does it make sense anymore? So we promised our board. So if you start thinking, how can I possibly start taking these things on in my organization? One of the key pieces is to tie it in with your own mission statement that the board's approved, your own values statement that the board has approved and has asked the CEO and the senior leaders to carry out. You use that language and you say, yes, I know we're concerned about finances, but we will do environmental interventions that will lower the cost of care, that will have a positive impact on our organization's finances and will improve the well-being of the community, because healthcare causes an awful lot. Look at health affairs this month on the number of bankruptcies and lawsuits caused by healthcare organizations around the country. And they actually highlighted Wisconsin, unfortunately, but it is enormous. And again, it affects people of color, people with the least amount of assets the most. So this is an opportunity to lower the cost of care for your organization and lower the cost for other people. It's a chance to improve the local economy by sourcing energy from regional sites. Our ability to do that, Wisconsin is an energy buying state. Vast majority of states are. They buy more energy than they really produce. And it allows you to start changing that dial. And it improves the health of the community. So we promised our board we would lower the cost of care, we'd improve the local economy, and we would improve the health of our community. So we tied in our population health people, we connected with our facilities people, we got the finance people interested, although very skeptical in the beginning. Eventually they became great supporters and great proponents of this work. So to implement it, you tie it in with the mission, and you are clear about saying it's not a project, it's a way of life. Remember the mission statement, remember the purpose, remember the values. It's a way of life. It is an opportunity to inspire our staff. This is one of the key benefits in organizations that have gone after this, especially now when almost every place in the country is hurting for staff. This is an opportunity to markedly change that metric. At Gunderson, people signed up to come to our organization. Number one, because of the quality of care, and number two was our environmental program. It became a huge impact on recruiting and retaining staff. So you develop not a project, but a way of life. And you say, oh my goodness, how can you get started in all this? You start with small things. Don't imagine you're going to change the world's climate or even change your regional pollution profile right off the bat. Many of you, I know from looking at the list of folks, have gone down this road quite a ways. And most of you would know that conservation is one of the best and earliest places to start. We were about an $800 million organization. We spent $2 million on conservation over a 2-year period. And every year thereafter, we saved $1.2 million in energy costs on that single activity alone. Now, it was a lot of activities. It was boring things. It wasn't windmills and solar panels and things that look really great on a billboard. It was pumps and motors and control panels and really boring things. But it saved us so much money. We could then turn back and say, you see, this is saving money. We're putting less pollution into the air. It's good for the health of the community. We have our community health experts here. They're our partners. We're going to lower the asthma, lower the COPD, lower the stress on the cardiac patients because our air is better. And we're going to decrease our costs. We're going to save money. And then when we started generating, we started improving even more. Now, lowering the cost of care improves your local economy because healthcare costs are one of the major burdens on small business, medium-sized, large businesses. But to move it out into the realm of organizational way of life, you have to hit all these marks to really get some momentum. Lots of positives. So we had energy conservation that went on. We lowered our profile in our buildings by 57% per square foot of the amount of energy we used per square foot. So it was very easy to show this over a very short amount of time was going to make a big difference. Now, we eventually went on to energy generation. You're going to hear from Clark from the Environmental Protection Agency, who was part of the Energy Star organization. I'm just checking on my clock, sorry. And so we used energy as one of the main pieces in to show what we could do, but we added many other places like pharmaceuticals. There's still a lot of places where a lot of pharmaceuticals go down the drain. They go to the sewage system. If you measure what's coming out of the sewage system in most communities in this country, you find cancer drugs intact, antibiotics intact, hormones intact, coming out into the water that we drink, the air that we breathe, the rain that comes down. This comes out into our environment. We not only decrease that to essentially nothing, but we figured out a way to decrease waste. And it wasn't magic. It was just going upstream and saying, why do we have so much wasted whatever the drug was? And then we talk to the nurses, we talk to the pharmacists, we get them excited. This is another important part. You in facilities, you in public health, you don't have to do this by yourselves. There will be many other people in the organization who will be inspired by this work. Nurses, pharmacists, physicians, administrative folks. The chief financial officer that I mentioned, she was very excited about this work and proving that it actually made fiscal sense. We changed our investment. We did many things that made great financial sense. Here's another quick example that you can make money on really fast. That's a tragedy that we need to do something about. There are thousands, probably millions of children in this country that go to bed every night hungry. We waste 30, 40, 50% of all the food that's produced in this country, wasted. We can be a part of fixing that. So we said, we have to stop wasting. It wastes money, and that's a good in any department that you're trying to work with. So we drop the waste by buying a $35 scale for the food assistant people, and they just measured the food that was going into the trash and got this chart. And then we worked backwards and said, how do we change that? And in almost no time, we decreased our food waste by a huge percent, 20, 40, 60%. And then we found some that was actually really quite good at the end of the day. We changed by half an hour when we did our supper. Salvation Army changed a half an hour when they served the other direction. And we were able to use hot food that we couldn't use yet another day right to their place. This is decreasing food waste. We started a 5th season co-op to buy food regionally from around our areas. Our chef went to, instead of the executive chef who was supposed to be cooking for me, no, he wasn't supposed to be cooking for me. He went out into the community, had 12 schools. He taught children how to eat fruits and vegetables. He worked with our population health people, said we need to decrease waste, we need to buy locally, we need to figure out how to lower our overall carbon footprint and lower the cost at the same time. So it's not an either or. That's the conventional wisdom piece. When we started out, they said, well, it's either local economy or pollution, one or the other. It's either our bottom line or the environment. And that was just not true. That was not true. We figured out ways to do that, but you have to measure. You have to be smart about it. A woman that is particularly good at measuring is Dr. Cassandra Thiel from New York Langone University. She measured the impact of many pieces in our supply chain where an awful lot of our carbon footprint lies, not just in the energy. She measured in that supply chain. She found that if they really had a strong recycling program at New York Langone, they could affect their carbon footprint by 1%. 1%. That's all. Now, that doesn't mean we shouldn't recycle. We of course should recycle. But we need to understand that we can't just have a recycling program, pat ourselves on the back and say, okay, we're heroes. We got 1% done. All these other things, reducing what we use, reusing things before, not using things that then go to waste or unused. All of us can be more disciplined. And you can call on many different parts of the organization to help you with this. So you don't have to be by yourself. I think the items that really made us move ahead more quickly was balancing it on the mission, paying attention to the mission of the organization. It was using short-term thinking to address long-term problems. And what I said was we would measure and fix incremental changes that would then add up to a long-term thing. When we buy things, we think long-term. When we make decisions on energy, we think when we build buildings, long-term thinking, not unit cost right off the bat. It's total life cycle cost of the item. So long-term thinking, but take small wins when you can get them as part of this big picture. And the other piece that's really important is collaborating with partners. There's so many partners. There's so many partners within your organization and your community. Because we made progress, we were able to inspire the school district, a university, a technical college, many of the businesses. They would all come look very hard what we were doing. Some of our people left and went and led things in other organizations, great, that did fabulous work. Women and men leaders who had come up in that system had gone off and did these other things farther out into the community as it spread. So the impact into the community, but the partners, you don't need partners that are exactly like you. They don't have to have the same culture, but they have to value the same things. They have to value the health of the population and believe that they have a responsibility to improve the well-being of the community. So that's it in a nutshell, and that's what I'm going to leave you with, that there is a huge health as well as a climate impact here, that we have a responsibility. We volunteered to be in healthcare. We have a responsibility to behave in a disciplined fashion and serve the greater good of the well-being of the community, including everybody in the community, not just those that happen to carry our insurance card, but because we affect negatively the health of that broad group. So we have a responsibility. So we need to just rise up and do that. And there's many opportunities. These kind of conferences are great. There's a national, international organization, Healthcare Without Harm, that, as Terry mentioned, I'm the board chair of that, that have many resources on their website, many examples of other organizations, just not ours, inner city, very rural, many organizations that have stepped up and said, we'll take this responsibility, it's part of our values, we'll improve the well-being of the health of our community, and we'll save money, and we'll improve the local economy all at the same time. So I'm wishing you well in this journey. My email will be available. We'll have some references at the end that you can look at, and hopefully we'll have a little time for a question and answer. Nancy?
Thanks, Jeff. That was wonderful to get us started. Really loved how, I heard you focus on, tie it to the strategic, tie the work to the strategic vision of your organization. Look at where you are and start there. And, like with any big process change, start with the small steps that get you moving in the right direction. And look at who is it that we should be collaborating with. So I have questions for you. I know Terry will have some too, but we do have a few that have popped up in the chat that I wanted to draw your attention to. And the first one, which I think is really important and is really something that's going to be a theme that all of our participants will see in the 2 breakout rooms that we go into, is around health equity. So, we, over the last 20 months of the world that we've existed in internationally, as well as in the US, we've seen a much more visible focus on equity, and particularly health equity, as a result of both the pandemic and, in the United States, the social justice movement, arising from the murder of George Floyd. So I'm wondering, and one of our participants has asked, from your perspective, how does this work connect into health equity initiatives? How should it be part of and supportive of how healthcare organizations and health systems are driving on equity overall? So where are those connections in your mind?
Well, I think that's very important, and I think that's should be an important part of all of our conversations. When you look at the studies on who's impacted by the pollution that's caused by healthcare organizations, by the manufacturers that serve healthcare organizations, by pharmaceutical, when you look at that, it is disproportionately affecting people of color, people of lower economic class, people of lower education, rural, urban. Everybody gets pounded by this. And so I think this is absolutely at the top of our responsibility. I talked about responsibility. Our responsibility is to just stop doing this. It's just not okay to keep polluting the way we have in the past. And we need to change. And now with the technology that we have and assets and partners, whether it's Healthcare Without Harm or the EPA or the American Hospital Association, the National Academy of Medicine, there's all these people. Vizient is a partner. There's so many partners. It's a matter of responsibility. We just have to take the responsibility and say, it's not somebody else's job, it's my job. It's my job, because all of our pollution affects the health equity equation disproportionately. And so we have to take that on, and this will make a difference. If all of healthcare did this, we'd have a ripple effect into all the other pieces that are connected to us and other not-for-profits and the businesses that we serve. I mean, it will make a massive difference on the well-being of the health equity disparities right now.
Mm-hmm. Yeah, and I think it also ties back to the way that you framed the issue of thinking about our environmental footprint, as well as our ability to, within our work with communities and in communities, to shift the environmental impact. It needs to move, from being these different projects that we work on, but
Yes.
rather being a very intentional undercurrent of all that we do. So all that we do should recognize our impact on our communities in many different ways, and everything we do should have that equity lens applied to it. And again, as a preview, that's what some of our panelists will be talking about shortly in terms of, as a facility or sustainability leader, as a community health leader, how do you draw out that intentionality? Terry, did you have a question or comment? I wanted to give you a moment to jump in on this.
Well, I thought that Jeff did a really good job of explaining how it equates, but anytime you're looking at change management and leadership in an overarching way, one of the things that really fascinated me with Gunderson and under Jeff's leadership is they were able to look at this as it impacts all of their populations with specificity around vulnerable populations. And I remember one time, Jeff had used these changes and really looked at his purchasing capacity, right? And was able to shift dollars to more local, diverse suppliers. In addition to that, I think one of the things that Jeff did, and his team, is they also made a decision to try to purchase things even like energy locally, and realized that that was building jobs and infrastructure. And I don't know if Jeff, if you want to talk a little bit about that, but if you open the window broader than just the environmental impact, right? You've got the economic, the health, and that. I don't know if you want to talk about that, where you, and I'm sitting in Texas, and Jeff got tired of buying renewable energy from Texas and sort of found a way to help the local economy and health.
Yeah, I don't have a thing against Texas and Wyoming. It's just, I'd rather visit there than spend all my money on their energy. Although Texas is really coming up on wind amazingly. I think the important thing is the spinoff effect of being intentional and saying, we are going to lower our impact, and we're going to do it by connecting with our regional food suppliers, our regional energy suppliers, our regional, and do it that way. You incorporated then in local businesses that got excited, universities could get excited, students wanted to do projects, people wanted to come and work for you preferentially. Our population health people could point to this and say, we are providing jobs, as you pointed out, Terry, that will raise the whole level of the local economy. And so it was slow and arduous. It was like, a overnight success that took a decade. But in fact, the ripple effect through the community improved the health of the community, improved the economy, and improved the spirit of the community, that gave people more optimism and more willingness to expand their businesses and do other things. Thanks.
We have someone in our audience who commented that while he really advocates for a life cycle approach, he also comments the budget always seems to drive the decision. So how do you overcome that? What's your perspective from that C-suite lens, Jeff, in terms of how can these frontline leaders balance out that long-term versus what's in the budget today or for next year?
Yeah, that's probably one of the most common questions that I get asked, and I'm feeling their pain. It is hard to move things up when it's hard to talk about planting a big garden when the house is on fire. So it is difficult, and so I would go back to do the things you can within your own departments and areas. Look for a connection to the mission and the vision and the values and the priorities that they've set out. Find these things like the energy one I mentioned that saves so much money so fast. That gives you some traction. Look among the senior vice presidents or board members who you might find a champion, a woman that has stood up in the past out in public and said, these are important priorities. Maybe she can help you provide some horsepower at the board. So you have to look in multiple directions, or sometimes it's even an outside business or university who your healthcare organization is very aligned with, that a leader from there can come back in and say, we need you to partner with on this, bring us along. So I think it kind of depends on your area, but don't give up. Look for friends. Like I mentioned, there's friends, Healthcare Without Harm, Practice Green Health have a lot of friends. There's many other places you can find friends to get some help with it. And someday, when we're back to meeting together again, there's some national conferences that are put on around this that are really quite helpful to help find a path forward.
Right. And we've had a request to be able to learn a little bit more about the specifics of how you reduced energy use at Gunderson. The comment says you mentioned things like pumps and controls. More detail would be great. Can you either kind of briefly talk a little bit more about that, or is there a paper or case study that you can point folks to?
Yes, we can, Ashley can post if you go to Envision, Gunderson Envision, it's the name of our energy program, and there'll be many examples there on that. But there are many more examples at the Healthcare Without Harm site that she'll put on. I guess what we did is we started pumps, we did an energy audit, and we looked around, and we even looked at the pretty new buildings. I mean, this is 2008. We looked at a building, came up in 2003. It was glass and steel, looked really nice. It was an absolute sieve. It was terrible. And we had fans running 24/7 that only need to run 8 hours a day. There's all kinds of things going on. So an energy audit is really where you start out, and then as you add anything new, you do that. You can look at retrofitting, lighting, and there are a number of pieces where you can make money very quickly. I mean, building a biomass boiler, spending several $1 million in a new facility to build a high-tech 1800-degree biomass boiler is not something I expect everyone to do. But once we got traction with these other things, then the board was willing to go along with that.
Thanks. One thing I would note to everyone listening in that we don't have slides today. We meant this to be purposefully more conversation, as the breakout rooms, which we're going to in just a minute, will also be. But what we are doing with Jeff's help and Terry's and the help of the speakers who you'll be hearing from in just a few minutes is accumulating kind of a resource list that we'll send out after this, as well as, we're reminding the chat and watching for that. So if you yourself have resources that are your go-tos in terms of case studies or other information, feel free to post them, and we can kind of curate and accumulate a larger list, including what you've used. Terry or Jeff, with just like a couple minutes left here before we head into breakout rooms, I guess I always ask people kind of Monday morning quarterback questions, especially since I'm a Cleveland Browns fan. So there's a lot of Monday morning quarterbacking to be done. But, so we've heard a lot about what went well and what were the successful approaches that you took. As you reflect back on some of the work that you've led or work that you've seen others do, there are always things that we could have done differently or maybe should have started with differently. Would you have any kind of that Monday morning quarterback of here's what I wish I would have known 10 years ago or when we started that you'd like to share with folks?
Well, Terry mentioned a book I wrote, Lead True, that has a lot of stories from me and a variety of people about successes. My next book is going to be all my mistakes. It will be 3 times thicker. There's a ton of mistakes. I mean, we made a lot of mistakes. I guess, what were the mistakes I did? Whenever you thought you had the flow of the board and the senior leaders heading in the direction, you were probably mistaken. That it took constant reminding, constant re-infusing of information to do that. The next was not broadening the umbrella for people to help on this. Ask for physicians that are excited, nurses that are excited, pharmacists, housekeeping people that are excited. There are people from all parts of your organization who want to stand up and say, I can help on this. And that would expand to the community. Don't be bashful. And now it's easier than it was 20 years ago. I mean, it's easier than it was 20 years ago to get that crowd of going. That was it. But we made mistakes. You know, the funniest one was when, and this will teach you something about media, we got awards for being the safest, best outcomes in the upper Midwest one time from health grades. They said, well, you're the best, you're top 3 in the country, blah, blah, blah. Your chance of dying at Gunderson so little, blah, blah. So it was great. So I got a headline in the newspaper, a couple attaboys, 2 emails, 2 pats on the back. That was it. 2 weeks later, we announced that we had a partnership with the local brewery a mile away from the hospital, that we're going to turn wasted brewery gas, methane, into energy for the hospital and save money. It went to 10,000 websites. I got 1 million emails. People were so excited about it. So it was a massive public relations victory. The problem was they changed the formula from beer to hard lemonade. They washed the vats with sulfuric acid and it killed the engine. So we ended up having to abandon that massive victory, and it cost me a bunch of money. The advantage was we hadn't made that big investment until we had many, many wins ahead of time. And when that happened, instead of just shutting down everything, the board said, well, you're a bunch of idiots, but we'll let you keep working. So I didn't get fired, and we were able to keep going. But that was a big mistake. We held on to that longer than we should have. So there's lots of mistakes, but I would say not expanding the net fast enough and not measuring were probably the 2 earliest mistakes we made.
Well, thanks for being brave enough to share those. And, the best thing we can do in healthcare is make sure that we're not repeating each other's mistakes. So would like to thank you again for giving us your insights and kicking us off.